You can ask questions online as well. Our friend Miss Ashley is the genius over there, and she will let us know. So
Yep.
so anyway, we're going to kind of get started, and we have a little PowerPoint that will be online. So
I'll do that as you go. I'll take care of it. Don't
okay,
worry.
but these guys.
I can certainly get it to you if you'd like it. If you'd like copies, I'll print them out before you go. I'll make sure you have them. Not a problem. I'll do that right now.
Perfect. So when you're first coming to the Cancer Center, just so you know our process, we have a screening form. And that screening form tells us if you're having any nutrition concerns. And then during that time, we'll kind of look through. And if you do, we will call and just say, how can we help you today? And let you know that we're here, because that's our kind of our first touch point of being with you and letting you know of our services. So we're happy to be on staff. We have 2 dietitians on staff at the Delmore Cancer Center, and we have 4 to 5 on staff at the Warrenville Cancer Center.
Oh, that was bigger.
Yeah. So we're happy. At our last national meeting, there were about 25% of the cancer centers in the country that had dietitians actually on staff. So we're so happy to be here and be able to support you. So that nutrition screening form kind of, checks some boxes if you're having trouble swallowing, if you're having any symptoms that need help with managing. And then we can call and email you, or we can even have you come in if you have specific questions. So that's kind of our first touch point. And then we have a booklet, and I'm going to give you guys this booklet today, just in case you don't have it, that talks about nutrition during cancer treatment. And the key things that we talk about are weight maintenance, hydration, food safety, and symptom management. So those are the kind of the things that we're going to be talking about today. And then during this series for the next 4 weeks, we're going to kind of go a little bit more in depth in certain of those topics. Please feel free to ask questions anytime. I really want to keep this a good dialogue so that I can help you guys out today and online if you guys have questions. So you have your own personal dietitian today. So the other things that we do talk about when we first meet with you, one is called a program called Fox Valley Food for Health. And I brought in a brochure so that you guys can check it out. But if you're within 30 minutes of the Kane County Flea Market where their kitchens are, you're eligible to get meals free of charge. And there are 4 meals per week, 4 entrees, 1 soup, and then 1 low sugar dessert. It's all Mediterranean based, and it's for you and your family. And then so you would just check with them to see if you qualify location wise, and they train high school students, culinary skills and food safety skills. And then they have adult volunteers that will drive the meals over to you once a week. So we're lucky to have this program in our area, and they work really hard. They actually garden with me at Moose Heart. We had started a big garden project there. And so they have a lot of fresh fruits and vegetables, and they're actually helping Moose Heart learn how to garden too. So that's a great resource if you haven't heard of it before. It was started by a dietitian and another person that was good with marketing, and so it's a really cool area. The other thing that we do for all of our new patients is talk about living well, and all the resources here. So just so you know, we have a whole culinary nutrition section on our website. We have a lot of recipes. We actually have videos on our YouTube channel, and we did a lot of those during times where we couldn't be in person. So we have a lot of recipe tips and things like that. So check that out. Do you guys like to cook?
Yeah.
She's like,
Sometimes, yeah. Yeah, easy stuff is good, yeah.
We like to have, we like to they're Mediterranean style recipes, but simple.
Okay.
We want to have things that are easy to do. We're encouraging cooking because usually that means you're having less processed foods. And so then you're eating healthier. So anyway, we have that section, and then there are so many other resources here. They have wonderful social workers. They have yoga classes. They have a beautiful yoga room. I feel like the library is very relaxing too, just to go in there. We have cookbooks in there that we know about, and we have other resources in there. They have, WIG resources, just a lot of things. So just kind of check all the resources out here if you haven't yet. So we know that chemotherapy can suppress the immune system. So we do talk about food safety. And the main thing that we talk about is hand washing. So when we're teaching our cooking classes here, and we also practice this, we get our hands wet, and then we add the soap and do the whole 20 seconds thing, and then rinse, and then kind of pretend like your surgeon hands. So, so that's something to keep in mind in general, so that we can all kind of be food safe. The other things that we recommend for food safety, there are certain foods that we recommend to avoid, and that would be raw or uncooked foods, just because of the increased food safety risk. So smoked salmon, for example, that's raw. Now, if you have smoked salmon on the grill with a smoker and it's cooked, that's okay. We just don't recommend the raw fish. We don't recommend raw sushi. We don't recommend any of those smoked. We recommend roasted nuts as opposed to raw nuts, but you can roast them at home, so that's okay too. You can roast it in a pan or
What
in the
about
oven.
like beef, like if you like rare beef, you would have to have like more medium well or
We
whatever.
do have a question, yeah,
Yeah.
we do recommend that, more medium to well. And the reason is because we don't want to have some bacteria causing a problem for you.
Okay.
Excuse me, so yeah, we do get that question.
Yeah.
Same with eggs, like,
Okay.
we don't recommend the runny yolk eggs.
Yeah.
Because, we might have that risk of salmonella, and we don't want that for you, so,
Okay.
so that's why.
It's okay because I like my meat cooked well, but the thing is, I.
You do?
I
Me
still,
too.
I
I'm
still,
always taking that little edge that's
Yeah.
most cooked,
Yeah.
yeah.
yeah, so.
So medium rare is not good?
Right, we
Yeah.
recommend more well
Medium.
done,
Oh,
yeah,
No pink.
No pink.
right.
Okay.
But, just a short amount of time, and just to make sure that you're not having any food safety problems.
Yeah.
We don't want that for you, so
Okay.
that's why I give those recommendations.
Do
We
they
don't,
recommend that for vegetables too, or can you eat raw vegetables?
no, raw vegetables are fine, but we do recommend washing them really
Yeah.
well
Okay,
and getting some friction on there.
okay.
You don't necessarily need to use a vinegar wash or anything like that, but just making sure that you're getting the friction on there is a good
Okay.
idea.
Okay.
Yeah, that's a good question. But raw vegetables are fine. For deli meats, we actually recommend, because there's so many people in the deli area, we recommend the prepackaged and then microwave to steaming at home. So that could either be in a skillet or in the microwave,
Okay.
but just making sure you're getting that temperature up so that you're, being more safe with that. We don't recommend salad dressings that are include a raw egg. So some restaurants, we don't actually recommend having a lot of salads when you're out, just because we don't know if they're washing. If you know that they're having a good food safety practice, then it might be okay. But the Caesar, for example, that's got that raw egg, that would also be a problem as far as bacteria risk. So we would say not to have that right now. If you're having the pasteurized, the next question is about blue cheese, and we don't
Okay. Yeah, I
recommend
don't
blue
like blue
cheese
cheese,
because
that's
it's one of
okay.
those moldier cheeses.
Yeah,
But if you have a pasteurized salad dressing or something like that that has the flavor of blue cheese, that's okay. So we just don't recommend those really moldy cheeses, the softer cheeses like Camembert, because of the food safety risk. Okay, does that make sense? We talk a lot about food safety, so. Yeah, so we talked a little bit about washing, making sure that we don't really recommend a lot of the pre-cut produce because there are extra hands. It's kind of like the deli. It'd be almost better just to rinse your melon at home and then slice it. A lot of people think, well, I don't need to wash melons, but when you slice through, that's taking the bacteria from the peel into the melon. So make sure you rinse that off and, get a little scrub on there with your scrub brush. Fresh salsa or even the triple watched salad in a bag, we'd recommend rinsing that again. just to be, extra careful. Any questions about that so far?
You answered this question in the chat, so you're
Oh,
good.
okay. Yay, okay, I'm glad you're out there, people. Okay, so the other thing is, well water. You may want to do bottled water during this time if you live on a property that has well water, just because we don't know if it's not going through that same water treatment process. So there may be bacteria there, so we just want to be a little bit more careful with that. Same with like sun tea or matcha tea, where it's sitting out for a long time, that may induce bacteria, so we would recognize not having that. Unpasteurized milk, juice, or honey, those would all be not recommended. Usually, like I found this little honey in our pantry here, and it doesn't say pasteurized on it, but it doesn't say raw either.
Okay.
So I looked it up, and it is fine. It is pasteurized, but you might want to just double check. Now, there are some local honey
I was
purveyors.
gonna ask you about that
Mhm.
because, like a lot of farms sell honey and stuff. Is that okay or not really?
Farmers markets, right?
Yeah, so those are
Yeah.
probably not pasteurized.
Yeah.
So we would be careful and not have those.
Okay,
Just because there may be a bacteria that we're not aware of. So the
Okay.
pasteurized is what we would want. So something that's processed in stores are probably fine. The health food stores, a lot of times you don't know if it's pasteurized or not.
yeah,
So I would just either check online or call the manufacturer just to make sure.
okay.
We're kind of being extra careful with all the
Well,
food safety, but we
Yeah,
have
and the only reason that I questioned it was because, I had read somewhere that they said that, like the raw honey or, the honey that comes from the farmers is actually healthier than, the store bought stuff, so I didn't
I
know.
know,
if
we
that
have
is
seen,
correct
we get a
or
lot
not,
of questions
so.
about that the nutritional properties may be higher,
Mhm.
but the recommendation
but for
is to
cancer,
avoid that during
Yeah.
treatment because of that food safety risk. Yeah.
Okay,
Yeah, no, that's a really good question. We get that a lot. People are trying to have raw honey. They think it's healthier, but
Mhm.
the food safety risk outweighs it. Same with agave syrup.
okay,
Because it's coming from Mexico, we don't know exactly how it's been processed, and it could be an increased risk.
okay,
So, we're extra conservative to protect you.
okay.
All right. Avoid unrefrigerated cream-filled pastry products we have here, and I think that kind of goes without saying. We want to be careful too. A lot of times people will bring meals if you're in treatment, and if you are not comfortable with their food safety practices, it might be good to say thank you very much and then discard it, because we don't want to be rude. However, if you know something's been out on the counter too long, if you're selling at someone's house or it's a dip or something like that, usually 2 hours is about the right amount of time. And a lot of times, especially in holiday parties, it'll be 3 or 4 hours, something will be out there. So that's a time where we would want to, it's not really healthy for anyone, but in treatment, we don't want to take those risks. Yeah, so just kind of be careful about that. Now, food safety practices when you're cooking at home are also important. We recommend leftovers only for 3 days. And then same with if you have things, on your counter at home, like we wouldn't recommend thawing out meats if they were, we don't recommend it on the counter. We recommend it in the refrigerator on the bottom shelf in a pan, and probably covered, just so that we don't want anything dripping over to the other foods.
Mhm.
But a lot of times we used to do that, where we would just lay it out on the counter, and we don't recommend that anymore. Anything that's moldy or slimy,
Don't eat it.
those things you thought you might taste to see if it's okay, we recommend skipping that whole process.
If
So,
it's moldy, it goes in the garbage.
right, yeah, that's right. If in doubt, throw it out, that's our little motto. And then eggs that have a crack, that could be an increased salmonella risk. So, overall, just being a little bit more careful. avoid cross-contamination where you're cutting meat on one cutting board and then have fruits and vegetables on the same cutting board. That can be cross-contamination. And then use a thermometer to check for doneness to make sure, like poultry needs to be 165 degrees. So just being really careful about that. Okay. Any questions about that? Okay.
Okay.
So as far as dining out, we do recommend, like I said, just kind of be aware of their food safety practices. My husband likes to go to these diners that might not be super clean. So I would say, you know, if you feel good about their food safety practices, then that's probably okay. A lot of times we will suggest avoiding the raw fruits and vegetables at those establishments, just because it'll be easier if you know if it's cooked, then it would be better, less of a risk. So that's something just to kind of keep in mind. We're not really doing salad bars and buffets anymore in this time of our world. So that's something that both bins we wouldn't really recommend, and potluck, sidewalk vendors, those could be a little bit tricky. I think you're getting the idea though, just if you have leftovers from a restaurant and they box them up for you to go head straight home, stick it right in the fridge. So you don't want to have things sitting out for too long, especially the protein foods. Okay, avoid purchasing the pre-cut vegetables. The whole foods are better. So getting a whole apple and washing it at home. Same with the melon. On to a new topic, supplements. Supplements can interfere with the treatment process. So especially vitamins A, C, and E, they spell ACE bandage. So we don't recommend a multivitamin during treatment. If you have a B vitamin, it doesn't have a vitamin C added, then that's fine. Vitamin D is okay, calcium. Some people are taking glucosamine for like arthritis pain, that's okay. If you're taking like calcium, magnesium, or iron, those are all fine. We don't recommend zinc or selenium or turmeric tablets. Now you can add turmeric to your food, that's okay, and it's really good on roasted vegetables. And it does have those anti-inflammatory properties that we want to kind of focus in on, but we don't recommend it in tablet form because it's too concentrated. It may throw off the balance of electrolytes in your system, and it also may interfere. We're trying to, with the treatment, trying to get rid of those cells we don't want, and those antioxidants are preventing any cell breakdown. So it kind of works against the treatment. So that's why we say to avoid those during treatment. Now, the question we get a lot is, was it okay if I have a little orange juice or an orange? Yes, that's totally fine.
Yeah, because aren't orange juices like replenishing your electrolytes and stuff?
Right, right. I mean, we don't recommend a lot of juice. We'd almost recommend having a whole orange first because you're getting all those nutrients. But if you're having a small amount of juice or that sounds good and you're not able to hydrate well.
4 ounce thing.
Exactly, that's totally fine. Yeah, and that does help. It does give you some good potassium and it gives you some good vitamin C. So, yeah.
And yeah, my doctor had recommended it because I have severe anemia right now with all this stuff going on. So like you said, it was the magnesium, iron, and calcium that he's having me add. And then he said, you know, just drink a small thing of orange juice too, you know, to help out. So
Exactly, that has good magnesium too.
mhm.
And it does help with iron absorption.
Oh, okay.
So having your protein food, such as chicken or fish or even cereal in the morning with your vitamin C,
Yeah.
which could be orange juice or red pepper or something like that, that can help if you have anemia. So for those of you that might not have heard the question, she was asking about having supplements that relate to anemia. So that's good.
Yeah.
Does that cover the vitamin with a little handout?
It does. Yes, it's
Okay.
all in there. Yes, yes. And if people online would like that, we can.
Yep.
Ashley is on top of that already.
Already
Just
on
let us know.
Yep.
Okay. If you wanted to take a B complex, we talked about that a little bit, that's okay. We just wouldn't want the vitamin C added. There's some B complex that have that vitamin C added, so that's okay. So the other thing to talk about for, with supplements is that there are a lot of supplements out there in the news, and we hear about this all the time. And a lot of people come in and say, my friend told me this, my friend told me that, or I saw this on the internet. So what we want to say is that most of those supplements are not regulated by the Food and Drug Administration. So we don't know if there are added things in there that are going to interfere with the treatment. So we want to make sure we don't recommend those. They're not part of the American Cancer Society guidelines because of that reason. So just kind of beware if you're getting a lot of that kind of information, check with your dietitian, and we can help you through that. Because there's a lot of information out there, isn't there?
Yeah.
Too much
I
sometimes.
know, too much sometimes.
My doctor told me to stay off the internet.
Just don't even go there,
Yeah.
right? Except if you're coming to a Living Well class,
Oh,
right? Well, and I think it can be very confusing, you know, we have a lot of that where people just, they're not sure of the source. And so, you know, that's why we are here to help you kind of weave through that and look at the source. Is it from the American Cancer Society or the, you know, American Institute of Cancer Research? Those are good places to check, and we know that those are good reliable sources.
Yeah, so.
Exactly. Okay, so our next topic is protein. I brought a lot of things here that we'll talk about at the end. So protein foods, we really need increased protein during treatment, and everybody has an individual amount of protein that they need that we figure out. We calculate it based on your height, and your activity and your medical history. So it's good to check with a dietitian. Sometimes we would say you may need 60 to 70 grams of protein, depending on your height. That's probably a man that's about 5'10", for example. And then during treatment, you might need 70 or 80. So most of us are not getting quite enough protein. I feel like we are talking about protein a lot. So especially for breakfast, we're usually a little low there. So we have maybe a piece of toast, and maybe if you add peanut butter, 2 tablespoons of peanut butter will give you about 7 grams of protein. But if you're looking for 10 to 15 at that time, you need to kind of add a hard-boiled egg.
What about like oatmeal or something like that? Is that a good source of protein?
Yeah, oatmeal is the question, and it has a little bit of protein, but if you make it with milk, add in peanut butter. Nobody's flinching, okay?
I like cinnamon myself, but.
Yeah. So if you add nuts or milk or something like that, there is a little bit of protein, but not quite as much as we would need. So you want to either have milk on the side or maybe have a little smoothie or a Greek yogurt. Greek yogurt can have like 12 to 15 grams per 8 ounces. Or an egg, yeah. Medium egg will have 6 grams. So if you marry that with milk in your oatmeal, yeah, that's a good idea.
Hey, Mayor.
Yeah.
Question from our virtual audience here. Does the staff at the Cancer Center tell me my recommended protein intake based on height and weight, or is there a formula or a chart to figure that out?
Yeah, no, that's a great question. And it's very individual. So you can ask the dietitian that you're working with, or you can reach out through Living Well, and we can help you figure that out. But it is very individual. If we have a patient that's, running 3 miles a day, their protein needs are going to be a little bit different from someone who is resting most of the day. And your protein needs might be different if you're age 30 versus age 50, in treatment, not in treatment. So there are a lot of factors that we look at. I would say usually it's 1.2 to 1.3 for kilograms, however many kilograms you are. So that's one place to start. But we don't want, a lot of people think, I've heard this lately, that you're supposed to have like the same amount of protein as your body weight in pounds, which would be way too high. So talk with your dietitian and we can help you with that. Yeah.
And I have another question for you too.
Yeah.
Canned nuts like planters, are they safe even if the can doesn't specifically say they're roasted?
If they say they're roasted, is that okay? Is that what the question?
No, if the can does not say, like
Yeah.
if there's, because sometimes they will say raw or roasted, but sometimes they don't at all.
Yeah.
So
Yeah, if they're, if they're, usually you can tell if they're roasted because they have a little bit of that, roasted flavor. But if you don't know, I would recommend just roasting them. It's pretty easy. You can put them on parchment on a lipped cookie sheet in your oven, say 400 for probably 10 or 15 minutes, just to make sure they're not turning black. Everybody's ovens are a little bit different. So I would say if it doesn't say, I did bring these, which are from Costco, and they say unsalted mixed nuts. And these are roasted even though they're unsalted, but usually I would say they would say roasted, but this doesn't say. So if I were in treatment, I would probably just go ahead and roast these. The other thing is when you roast them, they're so much higher in flavor. So a lot of times we'll roast them just so you can pull out that flavor. Great questions. Any other questions online?
Nope, you're good.
Okay. So we know that we need enough protein for healing. If there are some of us that have had surgery, we know we need protein during treatment. Our protein needs go up. And so we just want to make sure that we're meeting our needs. You can only absorb about 30 grams of protein about every 3 hours or so. So a lot of times people think, well, I'm having this nice big protein like chicken or fish or something at dinner, but no protein the rest of the day. That's going to be really hard to meet your needs because 3 or 4 ounces of chicken, for example, is 24 to 28 grams of protein. So if you're, not to be too calculated or anything, but if you're having 3 ounces of chicken at night and you have another 3 ounces, you're not going to be absorbing the protein for that second 3 ounces. You're going to excrete it. You're going to get the calories, but the protein we want to spread out throughout the day so that we make sure we get enough. Okay, Maggie, are you okay?
Yes, I am. Yeah,
So give me
no.
a question. Look.
Well, the thing is, I'm just thinking that, so what you're saying is that, just plan out your meals, like smaller meals during the course of the day?
That's perfect. Yeah, the smaller meals, but getting protein every time you eat is a
Okay.
great way to maintain that lean
Okay.
body mass.
Okay, so,
Yeah.
so like you have breakfast and then like at 10 o'clock or whatever, you have like a yogurt or something like that, and then you have your lunch and then you have some other small snack or whatever. Yeah.
Exactly.
So,
Yeah, no,
okay.
you are right on the money. That's exactly right. Having those small frequent meals is much more conducive to absorbing that protein.
Okay.
Yeah, so that'll be perfect.
I
So
already did it.
we do recommend too having protein in plant-based protein as well as chicken and fish. That's all part of the Mediterranean diet. So some tips for adding in more protein we have here: adding yogurt or nut butters or a protein powder to smoothies. So that would be good. Adding hard cooked eggs. We talked a little bit about that. Cheese, nuts are good in salads or soups. You could have cheese on there. Even sometimes like a little walnuts on the top of your soup. Eat fruit with yogurt, have cottage cheese, nut butters, mix cottage cheese with avocado and serve on toast.
Can you have like chili in, usually I have cheese on top of chili, and I know with winter coming,
Yeah,
that would be
that
good.
sounds good.
Yes.
Doesn't it? That does.
I know, I'm liking the soup idea all of a
Yeah.
sudden. Yeah, we're in that mode.
Yeah.
Yeah, adding cheese is good. Now that will add some extra calories too, if you're concerned that you're not eating as much. If you feel like you're eating too much, then just have a little bit of cheese.
Oh, okay.
But yeah, that's perfect.
I have a question, Mayor.
Yeah.
This is really interesting. I've never heard of this. I've read online on the Memorial Sloan Kettering website about drinking double milk. Have you heard of this? Non-fat milk powder added to whole milk in place of regular milk to increase the calories and protein in one glass.
Yes, I haven't heard it called double milk before, but it's kind of what it is.
Mhm.
And we do actually suggest that, like making Carnation instant breakfast with milk, because then you're getting kind of double the protein. And we're going to talk about a lot of protein ideas because this is something that's really important. But yeah, that's totally fine. And it's kind of a good way. It's easy to find Carnation instant breakfast. So yeah, that would be fine.
It is
Yeah,
good.
it sounds tasty. Yeah.
It almost
Yes,
sounds like a
that sounds
milkshake
good.
almost,
Are you talking
so.
whole milk? Milk or skim?
So that's a great question. It really depends on the person. And that's why we're on staff to help with all these individual needs. So if there's a patient that's losing weight and not able to eat, like say a little during their treatment, then we want to boost them up with whole milk on the times that they are eating well, right? But if it's someone that is maybe on aromatase inhibitor, then for breast cancer, then they may say, wait, I'm gaining some weight. So then we would say it's okay to have skim. You're still getting your protein and you're maintaining that lean body mass, but you don't have the extra calories of the whole milk. Yeah, that's a good question. All right, so we talked a little bit about what protein helps with, but it does help with that lean body mass. It helps with making sure that you're maintaining weight. Less muscle leads to weakness. So if we have that protein, that helps keep us strong, which is good, and that's what we want. We've seen better treatment outcomes with maintaining weight. So that's why our big focus. Protein is also needed for the immune system to function. So if I hear that people are having one meal a day, I'm going to suggest having a couple little protein snacks in there so that we can maintain that immune system, which is so important. And then protein is also needed to build new cells. So we want to make sure that we're building new cells just as we always need to. Okay, any questions about protein? Okay, good. All right, so we're moving on to treatment day. Some of you may already be in treatment, but for those of you that aren't, or you're wondering about someone that you know that's starting, we recommend go ahead and having breakfast, a normal breakfast. It doesn't have to be a 5-course meal, but having a normal breakfast is a good idea because you won't have an empty stomach. Sometimes people are concerned, if I am going to have symptoms, are they going to come right away? Usually it would be a little bit delayed, so that having breakfast will actually help you out. Sometimes people go through without having symptoms at all. So it's good to have that protein too. Yeah.
And I know that they had suggested to me, when I go for the treatment on that day to pack a lunch, you know, so.
Well, exactly. So you can bring, I know at the at the Northwestern Medicine Cancer Centers, you can bring a little cooler with a little lunch.
Yeah.
And that's fine. Or if you wanted to just do a peanut butter and jelly sandwich, where you don't have to worry about refrigeration.
And, yeah, and that's what I do.
Yeah, I love peanut butter and jelly. Yeah, that's great. Yeah, so that's totally fine. We do have snacks at the cancer centers. We have Lorna Doones is everyone's favorite. So we don't want to get rid of those. And those, you know, we say everything in moderation. It's okay. And sometimes those are easy to tolerate too, so that you they're just like a little snack. We do have like some trail mix. We have some apples and bananas. We have some fig Newtons and things like that. So we have some snacks there, and we also have some protein shake samples. We're going to talk about those in a minute. So, you know, if you feel like you forgot something, just let us know. We can bring you a little supply. We have beverages in there too, some small juices and like some ginger ale and things like that. Yeah. Okay. So making sure that you're getting that protein at breakfast is good. And some examples of a simple breakfast would be like yogurt with berries. A lot of times we'll recommend Greek yogurt because of the higher protein content. A scoop of egg salad, chicken salad. I have a little food model sample of that. I like telling people, if you like those, chicken salad, tuna salad, egg salad, any of those, having them in the fridge, you can take a few crackerfuls, and that really will give you a couple of ounces pretty quickly where you're getting some good protein and calories. So it's not a bad idea to kind of have that as a resource. Sliced hard-boiled egg sandwich with lettuce and tomato, fruit and Greek yogurt smoothie, and then whole grain toast with peanut butter and banana slices. So those are all some quick, easy breakfasts that you can have.
I was gonna say, I see you have Ensure there. I have like Lucerna, you know, so would that be considered like a meal replacement, or would that be just an added protein type?
Yeah, great question. Whether or not to have the supplement with your meal or kind of between meals, right? So if you're having a regular meal where you have a couple of eggs and toast with peanut butter and you're getting a good amount of protein, we would recommend having that glucerna between meals.
Okay,
Or another protein supplement to make sure you're spreading out that protein to be able to absorb it.
okay.
However, if you feel like you're not really eating as much,
Mhm.
that's a great thing to have so that you're not missing a protein meal. So
Okay.
yeah, so it can be a meal replacement if you want.
Okay,
Yeah, there's another one too. Oh, Kathy's gonna help me with the sampling in a minute. We're gonna sample some Ensure Max, and that's very low carb as well. So that
Okay.
could be another option for you
Okay.
with the glucerna.
okay.
Okay, good question. So how can we balance meals? It's important to aim for balance and snack choices that have carbohydrates, protein, and fat. So we talked a lot about protein, but we want to have some carbohydrates for quick energy. And then the fat helps keep us full too. So we want to kind of fit that in. The tuna on bread is perfect because it would have the meat or the fish, and then the mayo, which would be the fat source, and then the bread would be the carbohydrate. So that kind of gives you energy throughout the day. As soon as your carbohydrates are taken, then the protein is metabolized and then the fat. So it kind of gets you to the next meal. So that's a great idea. Omelet with cheese, tomatoes, and spinach. Whole grain toast. We talked about that a little bit. And then soup. We're in soup territory now. So having like minestrone that has some beans, and that gives you a good plant-based protein. So that's good too. So we talked a little bit about peanut butter, but hummus is a good idea too. Making sure that you're getting that in. String cheese or peanut butter, those are nice too, easy and portable.
Even the powdered peanut butter?
Yeah, so there is a powdered peanut butter, PB2. That's a great question, Phyllis. You can add that. You could add that to your carnation. But also you can add it to smoothies or yogurt. So it's a peanut butter powder, and it doesn't have the fat like peanut butter, but it does have the protein. So PB2 is a great idea for